Over how long?
6 months.
In the last 6 months. So your appetite decreased, but you gained 10 pounds.
Right.
Have you been weighing yourself daily?
No.
Have you been feeling any swelling around your ankles?
No.
Okay. Have you noticed any rashes or itchiness or dryness?
No.
Okay. Have you had any headaches?
Yes.
How about head injury? Have you had any of that?
No.
Okay. And so you have had the dizziness and you said you passed out.
Yes.
Okay. No visual changes?
No.
Do you wear glasses?
No.
Do you have any eye pain or have you had any eye pain?
No.
Any redness or swelling?
No.
Do you wear lenses?
No.
Glasses? No glasses? And you said
Only for reading.
okay.
Small lettering.
Mm-hmm.
I will put glasses on just because it's small lettering. Very, very small.
Okay.
I'm talking about the small that you got to read on the fine line.
Okay, so you haven't had any double vision or blurred vision?
No.
Okay. Any glaucoma?
No.
All right, and your hearing. You did say you had ringing of the ears, right? Any ear pain?
No.
Have you had an ear infection?
No.
And it discharges from the ear?
No. When I went in, they flushed it.
Okay, so it was
because they said it was vertical. They said the dizziness might have been because of cause of vertical. So they flushed both sides of the ear with hot water and peroxide.
okay. So it had earwax in them.
Yes.
Okay.
So they thought that was contributing to the dizziness. They said something about the little hair follicles might have had something on it which triggers off your.
Okay. Have you had a cold or
No.
no congestion, nasal obstructions in your
No.
nose? Any discharge from your nose?
No.
Itching?
No.
Hay fever?
No.
Allergies?
No.
Nosebleeds?
No.
Any changes in your sense of smell?
No.
Any sinus pain?
No.
Okay. Have you had any bleeding of the gums?
No.
Mouth pain?
No.
Toothache?
Yes.
Okay.
On toothache.
You have a toothache on what side?
Back molar. Left side.
Upper or lower?
Lower.
When was your last, you told me your last dental visit was a year ago?
Yeah, about that.
Okay, and any sores on your tongue?
No.
Dry mouth?
No.
Sore throat?
No.
Any hoarseness?
No.
And tonsils removed? How old were you when your tonsils were removed?
10 years old.
Any altered taste?
No.
Any lumps in your neck?
No.
Tenderness or anything of that nature?
No.
And no stiff neck?
No.
No borders?
No.
No pain?
No.
Okay, no limitations in moving?
No.
Okay, so in the last 2 months, have you had any lumps in your breast?
No.
Any pain or discomfort in your breast?
No.
Nipple discharge or redness?
No.
Any surgeries to your breasts?
No.
Any history of breast disease?
No.
How about in your family?
No.
Do you perform a breast exam?
No.
Okay. So there's no tenderness or redness or swelling around the dark part either, right?
No.
Okay. Okay, have you had any cough in the last 2 months?
No.
Any wheezing?
No.
Difficulty breathing?
No.
Painful breathing?
No.
Do you have a history of lung disease?
No.
So you are exposed to toxins on your job. Have you ever breathed in any of those toxins?
No.
Okay. Any problems or exposure to pollution?
No.
And your chest x-ray was 2 weeks ago?
Yes.
Any palpitations or irregular heartbeat?
No.
Okay. No swelling around your ankles or in the bottom of your leg or anything?
No.
Okay. Your fingers don't turn blue, do they?
No.
All right. Ask you some more questions here. Do you have to go to the bathroom in the middle of the night while you're sleeping?
No.
Do you have a history of heart murmur?
No.
Have you ever been told to have angina?
No.
Okay, but you did say cardio, CAD and hypertension.
Yes.
Okay, and you said no change in your, yeah, there was a change in your appetite. Have you had any jaundice? Do you know what that is?
Yes. No.
You don't have it. Okay, any nausea or vomiting?
No.
Have you had any heartburn,
No.
belching or pain in your stomach area?
No.
Any gas?
No.
You already said there's no change in your bowel movements. Any blood or anything in your stools?
No.
Do you have hemorrhoids?
No.
Okay. Any constipation or diarrhea?
No.
Okay. And you tolerate your food well?
Yes.
All right. So you don't have the incontinence, we already answered that. Okay, when you're urinating, is the stream strong and steady, or do you have to force it out?
No. Strong and steady.
Okay. No pain in the testicles?
No.
Okay. No discharge from your penis?
No.
Have you had a diagnosis of HIV?
No.
Okay. And your sexual habits?
That's a good one. Normal. Nothing outrageous, nothing that would,
Is it frequent or 1 or 2 times a week, 3 times a week, 4 times a week?
it
How
would
often are you
be,
sexually active?
yes, it would be 4 times a week.
Okay. Any masses or testicular pain in your testicles?
No.
Okay, do you examine your testicles?
Yes.
How often do you do that?
Once a month.
Okay. Do your fingers ever feel cold and tingly and numb?
No. I wear gloves all the time.
So they're not cold and tingly and numb?
No.
How about your legs? Do you get any cramps in your legs, or
No.
do you have any varicose veins?
No.
And no history of blood clots
No.
or discolorations in your hands?
No.
No sores on your feet?
No.
Okay. And in the last 2 months, have you had any muscle pain or joint pains?
Just a little in the right arm, because I haven't worked it out. At work, I would use it all the time.
Okay.
So not doing the same repetition of doing the job, yes.
And what relieves that?
Hot,
Compresses?
yes.
How often do you have those?
I say once a week for about an hour.
Okay. And it's just a cramp?
Yes.
Okay. All right. We already heard that you have syncope. You passed out before.
Mm-hmm.
Have you had any history of seizures?
No.
Weakness?
No.
Paralysis?
No.
History of stroke?
No.
Numbness or tingling?
No.
Any tumors or tics?
No.
Involuntary movement?
No.
Any coordination problems?
No.
Any memory disorders
No.
or mood change?
No.
Any mental disorders?
No.
Have you had any hallucinations?
No.
Okay. Do you have a history of anemia?
No.
Any bruising
No.
or bleeding?
No.
No blood transfusions
No.
or reactions?
No.
Any lymph node swollen?
No.
And have you been exposed to any radiation?
No.
Okay. Hot and cold intolerance?
Can't tolerate hot.
What happened? Oh, you passed out when you
Pass
had
out when I got hot.
Okay. Any excessive sweating?
Yes.
Okay. So you have a lot of sweating.
Yes. It just comes on. I can
Okay.
be sitting there. It's too hot. It's just gonna be extra.
Okay. So it goes along whenever you're getting hot.
Yes.
Okay. Is that when the dizziness start as well?
Yes.
Okay. So it's being too hot.
Yes.
Okay. You already said that you don't have polyuria or urinate a lot.
Yes.
Glove or shoe size? Any history of diabetes?
No.
Any thyroid problems?
No.
Any hormone replacement medications that you're taking?
No.
Okay, no abnormal hair disturbance?
No.
When did you go bald?
About 10 years ago.
Okay.
40.
Any nervousness?
No.
Do you feel depressed?
Yes and no. Not depressed to the part where I give up, but certain things work, but then trying to get back to work and the routine of it's taking too long.
So you're depressed about not working?
Yes, I'm gonna be working.
Have you had to take any medication for that depression?
No,
Okay. So when you're feeling depressed about not working, what do you do to make yourself feel better?
I watch some comedy movies
Okay, so you think of something that's gonna make you laugh.
and it makes me laugh. It takes you right off of it.
So it gets rid of the depression?
Yes.
So you don't have any thoughts of suicide? Any attempts?
No.
Have you had any history of mental illness?
No.
Okay. Well, Mr. WG, I thank you, and we will be taking care of all this.
Thank you.
Thank you very much.
Thank you.